A second article, the Hindu newspaper. No room for complacency on taking Omicron. India recorded the India recorded its first death caused by the Omicron in the full vaccination person in Rajasthan on the last day of 21. The 73-year-old man with comorbidities had tested positive on December 15. Preliminary evidence from South Africa and the UK suggested that, unlike the Delta variant, a majority of the people with the Omicron, particularly in the fully vaccinated, exhibit only mild disease. Hospitalization is relatively less among the vaccinate. A huge percentage of the population in India was infected than the Delta variant regard last year. Students from the countries have showed that such people might enjoy the same level or even better protection from the several disease than fully vaccinated people. Hybrid hybrid immunity achieved achieved though fully vaccination in the people who have been provisionally infected offers in the highest level of the protection against the several disease as or as several students in India outside India showed, with vaccination picking up speed after the second wave peaked in India. A significant percentage of the fully vaccinated might possess hybrid immunity. Even a single dose of an mRNA vaccine in previously infected people has been found in induce a high level of the hybrid immunity. If vaccination coverage with at least a single dose has already crossed 90% in those above the 18 years. The rollout of the vaccination from the adult less sentence will widen the protective net, but the immaterial of the protection confined. It is too early to draw any conclusion about the Omicron's violence. For instance, in the US, the first Omicron-related death was in an unvaccinated person who was previously infected. The time lags between the infected and the hospitalization should be another reason why it is too early to pronounce any verdict on the virulence of the variant in India. Viewland reveal population run and the rise of suffering suffering from several diseases in spite of their vaccination state. The unprecedented speed at which Omicron is spreading in the countries that have high level of the testing, the number of the people a single infected person can spread in the virus to and a double a, and a doubling time of the less than the 3 days are a loud warning that things can go out of the control soon. Mild mild symptom notwithstanding it higher transmission reality can pose can pose and several threats to the health health care sitting as a high number of the infected within a short time could lead to the more people needing hospital care. Overwhelmed hospitals can make it harder to the provide much needed care needed to the mountain death. The situation can become even more challenging than the health care. The situation can become even more challenging when the healthcare setting suffering from staff shortage caused by the increasing the infection among the healthcare working as a seen in many hospitals across the India. India should learn from the hard lesson from the second wave. Strictly uh, Aadhaar to COVID approaching behavior and the increase in the vaccination coverage, getting the getting the misled by the mild nation of the disease and the throwing causing to the wild will be a dangerous gamble.